This is the JADA device, and I grasp the loop with my dominant hand, so I'm right-handed. I pinch the loop to make it smaller to facilitate entry into the uterus. I slide the device over my right hand so that the loop itself ends up in the lower uterine segment and flat like this. And then the cervical seal, which is this green portion here, is actually at the external portion of the cervix, outside of the cervix. And once it's blown up, it creates a seal in that way.
I think that with anything in obstetrics, you have to learn to remain calm. And one of the ways that you can remain calm is to really get your entire team in the room comfortable with what's happening. And so we simulate this procedure and all different kinds of procedures all the time. So everybody in the room is very comfortable with what we're doing. So I would say that's the first tip that I've learned, is to make sure that everybody is calm in the room and understands they're part of the process. So they are getting the JADA, once I've asked for the JADA, they are getting it prepped for me as I'm continuing to assess the patient and make sure that I'm sweeping the clots from her uterus. So they pull the air out of this device. So there's a little bit of air in the cervical seal for packaging. And then they pull that out and they get two 60cc syringes of sterile fluid ready for me. They have my tubing ready. They know that my suction is set at 80 millimeters of mercury. And then I'm assessing the patient. I've asked for different medications that are running. And then I sweep the uterus. And as soon as I sweep and I turn around, they hand me the JADA device. And my right hand is always inside the vagina for assisting purposes. And I do that for a couple of reasons, because the uterus fluxes between contractions and atony while it's trying to contract on its own accord. So I place my right hand inside the vagina, and then I usually grasp just distal to the cervical seal and place it inside the vagina. And as I do this, because this is malleable, it occasionally will curve on itself. So I use my right hand to then guide that into the lower uterine segment. And once I get this inside the uterus, then I just retract my hand a little bit, and then I hold my hand next to the cervical seal. I'll hold onto this tube distally with my left hand, and I usually just adjust so they can get access to this port to fill up the cervical seal. And then either a scrub tech or a nurse who's scrubbed with me will fill the cervical seal up to 120 cc's. The IFU says that you can use 60 to 120 cc's. I always go straight to the 120 cc's just based on my experience.